Atacand Hct is used to treat high blood pressure. Lowering high blood pressure helps prevent strokes, heart attacks, and kidney problems. This medication contains two drugs, Candesartan and Hydrochlorothiazide. Candesartan belongs to a class of drugs called angiotensin receptor blockers, ARBs, which relax blood vessels so blood can flow more easily. Hydrochlorothiazide is a water pill, diuretic, that increases the amount of urine you make and also helps to relax the blood vessels so that blood can flow more easily. Atacand Hct is used when one drug alone is not controlling your blood pressure. Your doctor may direct you to start taking the individual medications first, and then switch you over to this combination product if this is the best dose combination for you. It is important to take this medication as directed by your doctor and to follow the recommended daily dosage. It is also important to take Atacand Hct at the optimal timing as advised by your doctor. Before you start taking Atacand Hct, make sure to read the patient information leaflet provided by your pharmacist. Take this medication by mouth once daily, with or without food, as directed by your doctor. It's best to avoid taking this medication within 4 hours of bedtime to prevent having to get up to urinate. The dosage will be based on your medical condition and response to treatment. It's important to take this medication regularly at the same time each day to get the most benefit from it. Even if you feel well, keep taking it as prescribed. It may take up to 4 weeks before you get the full benefit of this drug. If you also take certain drugs to lower your cholesterol, make sure to take them at least 4 hours before or 4 to 6 hours after taking Atacand Hct. And remember to inform your doctor if your condition does not improve or worsens. When starting Atacand Hct, you may experience dizziness or lightheadedness as your body adjusts to the medication. To reduce the risk of these effects, be sure to get up slowly when moving from a sitting or lying position. It's important to remember that this medication has been prescribed to you because your doctor believes that the benefits outweigh the potential side effects. Many people using this medication do not experience serious side effects. However, Atacand Hct can cause dehydration and electrolyte imbalance. Make sure to contact your doctor right away if you experience symptoms such as extreme thirst, dry mouth, muscle cramps or weakness, fast or irregular heartbeat, or confusion. You should also inform your doctor if you experience fainting, signs of kidney problems, joint pain, symptoms of high potassium levels, decrease in vision, eye pain, or any signs of a serious allergic reaction such as rash, swelling, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects. If you're in the US, you can report side effects to the FDA at 1-800-FDA-1088, and in Canada, you can report them to Health Canada at 1-866-234-2345. Always consult with your doctor about the best time to take this medication, as well as the proper dosage for your specific needs. If you are pregnant or planning to become pregnant, it is important to avoid taking Atacand Hct as it can cause harm to an unborn baby. It is crucial to use reliable forms of birth control while taking this medication to prevent pregnancy. If you suspect you are pregnant, inform your doctor immediately. Before taking Atacand Hct, it's important to let your doctor know if you have any allergies to Candesartan or Hydrochlorothiazide, or any other allergies. This medication may contain inactive ingredients that could cause allergic reactions, so it's essential to discuss this with your pharmacist. It's also crucial to inform your doctor or pharmacist about your medical history, especially if you have kidney disease, liver disease, dehydration, electrolyte imbalances, gout, lupus, or skin cancer. Atacand Hct may cause dizziness, and consuming alcohol or marijuana can increase this effect. It's important to avoid driving, operating machinery, or any activities that require alertness until you know how this medication affects you. In addition, excessive sweating, diarrhea, or vomiting can lead to dehydration, so be sure to stay hydrated and contact your doctor if you experience prolonged episodes of these symptoms. If you have diabetes, Atacand Hct may affect your blood sugar levels. It's essential to monitor your blood sugar regularly and discuss the results with your doctor. Additionally, this medication may impact your potassium levels, so it's important to consult your doctor before using potassium supplements or salt substitutes containing potassium. It's important to be cautious in the sun while taking Atacand Hct, as it may make you more sensitive to sunlight and increase your risk of skin cancer. It's advisable to limit sun exposure, avoid tanning booths and sun lamps, and use sunscreen and protective clothing when outdoors. If you are an older adult, you may be more sensitive to the side effects of this medication, particularly dizziness and changes in urine output. Finally, if you are pregnant or plan to become pregnant, it's important to discuss this with your doctor, as Atacand Hct may harm an unborn baby. This medication also passes into breast milk, so it's essential to consult your doctor before breastfeeding. When taking Atacand Hct, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Be sure to consult with your doctor before starting, stopping, or changing the dosage of any other medicines. Some products that may interact with Atacand Hct include aliskiren, dofetilide, lithium, and drugs that may increase the level of potassium in the blood. It's important to also be cautious of ingredients in other products that could raise your blood pressure or worsen your heart failure, such as cough and cold products, diet aids, or NSAIDs like ibuprofen and naproxen. Always consult with your pharmacist on how to use these products safely. Additionally, Atacand Hct may interfere with certain lab tests, potentially causing false test results. Make sure to inform the lab personnel and all your doctors that you are taking this medication. If you suspect an overdose and the person is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help by calling 911 or contacting a poison control center. In the US, you can reach your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. Symptoms of an overdose may include a rapid heartbeat, severe dizziness, and fainting. It's important not to share Atacand Hct with others. While taking this medication, you may need to undergo lab and/or medical tests, such as kidney function, blood mineral levels including potassium, and skin exams. It's important to keep all medical and lab appointments and consult your doctor for more details. To help Atacand Hct work better, you may want to consider making lifestyle changes, such as participating in stress reduction programs, exercising, and making dietary changes. Talk to your doctor or pharmacist about lifestyle changes that might benefit you. It's also important to have your blood pressure checked regularly while taking this medication. You can learn how to monitor your own blood pressure at home and share the results with your doctor. If you forget to take a dose of Atacand Hct, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take your next dose as usual. Don't take a double dose to make up for the missed one. It's important to take Atacand Hct regularly and at the same time each day for it to work effectively. When it comes to storing Atacand Hct, it's important to keep it at room temperature, away from light and moisture. Avoid storing it in the bathroom, and always keep it out of reach of children and pets. When it comes to disposing of Atacand Hct, make sure not to flush it down the toilet or pour it into a drain unless specifically instructed to do so. When the medication is expired or no longer needed, it's important to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.